Hi, everyone. I'm Dr. Omer Awan. I'm a radiologist, physician, vice chair of education at University of Maryland School of Medicine, and the associate PD for the Diagnostic Radiology Residency. I want to shed light today on what factors PDs consider when ranking candidates, because I feel like there's not a lot of information out there about this topic. And really, it's very difficult, and this is a very complicated topic, and pretty much everything counts when we rank candidates. It involves a very complicated process with respect to a lot of stakeholders, PDs, faculty members, those on the selection committee, even residents that have partaken in interviewing and are part of the process, residency coordinators. Everyone's opinion really matters, and everything that you submit really matters. So that means everything like your EROS application, your personal statement, your CV, your school record, your scores, your letters of recommendations, even your hobbies, to even all your interactions with residency coordinators, residents, faculty members, your interview, and even the communication that you have after the interview, like thank you notes, maybe a letter of interest or a letter of intent. All that plays a role in your rank. But if I were to think about 5 things or 5 factors that are most important when we consider ranking you in our rank order list, this is what I would say. And I think the vast majority of PDs would agree with, obviously, some people disagree with some things that I say, but if I were to rank them in order too, number 1 would be absolutely your interview and your interview performance. How you perform on the interview is by far the most important thing that decides your rank on the rank order list. Because honestly, if you get an interview, you are good enough to match at the program. We've already done the screen. We've gone through your EROS application. We know you're good enough to perform at our program. So we're trying to tease out and see if you're a good fit in the interview. So the things that we're trying to tease out are things like, how motivated are you? Are you going to be a team player? Are you going to be easy to work with others? Do you have great professionalism characteristics? Are you kind? Are you empathetic? Are you trustworthy? All these things we're factoring out when we interview you. And this is what we're trying to tease out. So definitely, I think the interview is a huge, huge opportunity for you to really make a dent. And, honestly, when the interview comes, I feel like everyone's on the same playing field. Everyone from the person who got a 280 on step 2 to the person who got a 220. We interviewed you both. It comes down to, your interview performance is that key and that crucial. And it really allows us to understand you more on a human level. So definitely, I would say that's the number 1 factor we consider when ranking candidates. The second thing I would say is your academic performance. Absolutely. Your grades in medical school, your scores on your boards, all these things really do matter. And the bottom line is that residency is tough. We want to make sure that you're going to succeed in residency. We want to make sure that you're going to pass the boards. And the proof that we have of that is your academic performance. So we want to make sure that that's sound. So that also is a huge consideration in your spot on the rank order list. The third thing I would say is letters of recommendation. So, of course, we've already reviewed that before we interview you, but this is an opportunity to hear what others who have interacted with you longer than we have think about you. And oftentimes we know the people that are writing the letters and we trust them. So when they talk about certain things about you, we gain a lot of information about you as a person. And, we don't really care that, oh, you got a 285 on step 1 or step 2. Of course, you can't get a 285 on step 1. It's pass fail. But we are looking for those professionalism characteristics. The things that impress us are things like, oh, wow, he's trustworthy, or he came in early, stayed late. He is just such a compassionate human being. These are the things that we're looking at that we want to add you to our family in our residency program. So the letter of recommendation can definitely be very powerful, particularly if we know the people, we trust the people. So don't underestimate your letter writers. Whenever you ask for a letter, make sure you always ask, like, can I please get a strong letter of recommendation from you? All these things make a huge difference. The fourth thing I would say is just your interaction with everyone during the process. So even residency coordinators, residents, other faculty, the way you treat residency coordinators, we get feedback on that, right? So, and that affects ranks. I've seen people tank on the rank order list because they were arrogant towards residency coordinators. I've seen people rise on the rank order list because they were super nice to the residency coordinator. So everything counts. And your interaction, your demeanor, how enthusiastic you are, all that counts. Even when you're during your interview process, you may be in a room with residents between interviews. If you turn your camera off, that doesn't show a lot of enthusiasm, right? And that can affect your place on the rank order list. So all those things matter. The more interactive you are, the more enthusiastic you are, the more energy you put into the process, the more reward you'll get. I think finally, the fifth thing is that, advocacy. So we want to see, and this often sometimes does affect the interview process and the rank order list. So did anyone advocate for you? Did you have someone, your letter writer, write to us, or a resident or a faculty member say, hey, this guy, or this person was just amazing. They should be ranked high. This advocacy from other people can often help. It doesn't always help, but it puts you on our radar. We think about it, and sometimes it can bump you up a little bit on the rank order list. So that advocacy can definitely be meaningful, and don't underestimate that as well. So I think, honestly, those are the 5 major things that we consider as PDs when ranking candidates. I hope that was helpful. Hope that'll inform you in your plan during this interview season and future interview seasons. That may help you, land the best residency of your choice. Hope that was helpful. Please subscribe to our Med Ed page. Please support our mission, helping everyone. I want to help as many medical students as I possibly can. Thank you for your attention, and we'll see you next time.